Finding effective treatment for a teen with PTSD can feel overwhelming. The stakes are high. Untreated trauma physically alters a teen's developing brain, affecting impulse control for life. But there's hope. The adolescent brain is incredibly plastic, meaning it has a profound capacity to be rewired. Specialized residential programs are built to create the exact environment needed for this rewiring to happen. We'll show you exactly how these programs create a healing environment and use therapies that remake the brain for recovery. So, what's the first step to healing? It isn't therapy, it's safety. These centers provide a structured, predictable routine. This immersive setting removes daily triggers, like social stress or reminders of trauma, so the brain can exit survival mode. These are not adult programs for kids. Centers often specialize in adolescents, built for their unique needs. This care is delivered by a collaborative team of therapists and psychologists who create one individualized plan for each teen. So you have a safe place, free from triggers, a program designed specifically for teens, and a dedicated care team. With safety established, what therapies do they use? 2 evidence-based methods form the backbone of treatment: TF-CBT and EMDR. Trauma-focused cognitive behavioral therapy, or TF-CBT, is considered the gold standard. It teaches practical skills to manage emotions. It also guides teens to safely process the traumatic memory, changing its power over them and storing it in the past. Then there's EMDR, which uses bilateral stimulation, like eye movements, to help the brain reprocess traumatic memories. The goal is to reduce the vividness and emotion of the memory. These therapies don't just manage symptoms, they change the brain. But talk-based therapy isn't the only way. What about emotions that are too difficult to put into words? This is where expressive arts, like music and art therapy, come in. They offer a nonverbal outlet to process deep feelings. Another vital component is the peer community. For many teens, it's the first time they are around others who understand. This connection breaks the profound isolation that often comes with PTSD, fostering a sense of belonging and shared healing. And healing can't come at the cost of their future. Integrated academic support keeps students on track with their homeschool. Let's address a common fear. Is this like a jail? The reality is the opposite. These programs are about empowerment, not confinement. Healing doesn't happen in a vacuum. A mandatory part is family therapy, which rebuilds communication and support at home. PTSD rarely travels alone. Programs treat co-occurring issues like depression or anxiety as coping mechanisms for trauma. You should also know that PTSD symptoms can appear months or even years after an event, so timely intervention is always needed. With all this complexity, how long does treatment need to be? Research gives us a clear and sometimes surprising answer. While a shorter stay might seem appealing, data shows that 60 to 90 days or more is linked to better long-term recovery. This extended time is needed for the brain to form and solidify new, healthy neural pathways, making recovery more durable. Let's connect the dots. Remember the brain's threat response? The structured, safe environment is what turns that alarm off. Only when that alarm is off can the brain be receptive to work. This stability allows therapies like EMDR to actually reprocess memories. And this neurological healing is reinforced daily by the peer community and family therapy, making the new pathways stronger. It's a complete system where every part supports the others. That is the distinct advantage of this kind of residential treatment. So what are the real-world results of this intensive approach? The data is encouraging for families. Statistics show that around 50 to 60% of teens experience significant symptom improvement after completing this type of treatment. The goal is to equip teens with the stability and neurological resilience to return to their lives with a reduced risk of relapse. If your family is facing this challenge, know that profound healing is possible. The first step is seeking a professional consultation.